Dr. Ali Khan, what is the U.S. doing wrong?
So it goes right back. So, in the early days, I said it was lack of imagination. So, the U.S. had sort of been sucker punched by this outbreak. But at this point, it's very clear we don't have a national strategy based on the 4 principles that everybody else has used to get rid of this outbreak. Simple 4 principles, right? So the first principle to contain this outbreak is leadership. So that's integrated whole of government leadership from the local, state to national level. We still don't have that. We can't agree on so many things that are important. The second part is get down community transmission. And this is the role of government to make sure we're testing and tracing. Nobody's talking about that anymore. Isolating cases, quickly finding those contacts, nor does anybody talk about the metrics around that. The third thing is community engagement, and that's our role, right? Wear a mask. Please wear a mask. Wash your hands, social distance. And the fourth thing is do what you can to make sure that people who are hospitalized are more likely to survive. And the one drug we know that does that right now is dexamethasone. So those are 4 simple principles, a national strategy, 4 principles. We can get our disease contained like so many other countries all over the world.
Dr. Khan, you're the former head of the CDC's Office of Public Health Preparedness and Response, which included overseeing the Strategic National Stockpile on emergency medical supplies. Can you account for, many months into this pandemic, the United States continuing to have a shortage of tests and masks?
I have no explanation for that. I have said I could have grown polypropylene trees by this time for nasal swabs, given the ingenuity of Americans and our biomedical complex to create these materials, personal protective equipment to contain make tests. So I really have no explanation for that. I can say, though, that we have enough testing in the United States currently if we used it correctly and we got a timely result back and didn't have to wait a week for the results.
And how optimistic are you about the development of a vaccine?
I am optimistic. However, the road to an uncertain vaccine is paved in death. Right, so we talk about 60,000 cases a day. So that's basically we're minting 600 to 1,000 new death certificates every day. Right, we can't wait for a vaccine. Right, and other countries have gotten their diseases contained and eliminated without a vaccine. So yes, I would love a vaccine. There's lots of data that makes it problematic. Immunity may be short-lived. We've never had vaccines based on these technologies. So as anybody else, I'm optimistic. I hope there's a vaccine. We don't need a vaccine today so that we don't kill another 600 to 1,000 people tomorrow. We have the tools.
Can you talk, Dr. Ali Khan, about what it would mean if the President of the United States simply put on a mask on a regular basis? Trump seeing a mask as weakness. Only this past weekend, you saw him for a minute wearing a mask, and he said, well, he was in a hospital. The significance of what this would mean at the federal level, then you see it go down to the state level. His biggest allies, DeSantis, the governor of Florida, for the first time donning a mask. In Arizona, we're going to go to and speak with the mayor of Tucson today. Governor Ducey, a recent death in Arizona of a Mexican-American man. His daughter said, I say that the governor and the president have blood on their hands. Do you feel the same way, Dr. Khan?
I believe all of government has blood on their hands. 136,000 deaths, preventable deaths, a tragedy. There's a lot of blood to go around here, Amy. Let's be very honest. If you look at the rest of the world that's contained their disease and some even eliminated. So there's a lot of blood to go around. But what you saw in countries that was successful was that each and every politician, regardless of their party, followed the science. So everybody said, wear masks. No controversy. Everybody wore a mask. They got their disease under control. And we need to see that again right now at every political level, local, national, local, state, national. Wear a mask. That's one of the 4 strategies that will get us out of this mess.